Hello everyone, so welcome back. In this video we are going to learn about drug distribution system in hospitals. So basically a drug distribution system is a system where we are transferring the medication from storage area in the hospital to the patient's bedside. Actually the distribution starts with the pharmaceutical industry, mainly from the manufacturing drugs unit. So from this unit it will through the help of intermediaries it will get transferred into the public sector, private sector and non-governmental organizations which acquire the medications through these intermediaries, and from these intermediaries it will have transferred to the public, private and non-government organization. In that it will transfer from the storage area to the patient's bedside. So next is the dispensing of the drugs to the inpatients. In inpatients, the medications are dispensed through the four types of systems. These are generally individual prescription order, complete flow stock system, combination of individual and flow stock system, and the last one is unit dose system. So in that we are going to learn about this individual prescription order system. It's a very common system. In this system the individual patient, he will get medication directly from the pharmacy after the issuing of the written prescription by the healthcare provider. So in this the healthcare provider will prescribe a medication. Through that prescription he will get medications directly from the pharmacy department, and by obviously by paying the charges. So this system is usually carried out in small and private hospitals, and they are very suitable system in small hospitals because of the reduced manpower and due to its economy. Next, it has certain advantages and disadvantages. The advantages are as follows. These medication orders, whatever the medication orders are there in this system, are directly reviewed by the pharmacist. Because of this the medication errors will get reduced, and they also provide a close liaison among the physician, the pharmacist and the nurse and the patient only in the matter of the medication, and it also gives a closer look on the control of inventory. And the disadvantages include they will get then there'll be a chances of a possible delay in obtaining the medications. Then the cost of the medication will also get increased. Next is the complete flow stock system. So in this system it involves the storage of pharmaceuticals and OTC drugs. So in this the medications will be reached to the nursing stations, and these the complete flow stock system is further divided into the charge flow and the non-charge. So generally a flow stock system means the medications, whatever the pharmaceuticals or the OTC medications will be there, it will be stored at the nursing station. And so in the flow stock system the first one is the charge floor, and so in this whatever the charges will be there, it will be made directly in the patient's account after administration of the medication. And in the non-charge flow stock system the charges will not made directly into the patient's account even after medications administration. So in the non-charge flow stock system, here in this system the charges will be calculated per day basis. So these will be calculated on the basis of per day, which can be including the hospital or the room or the ward charges and other. So next in the charge flow stock system, every dose of the medication administered to the patient will get charged, whereas in the non-charge, in the charges will made indirectly into the patient's account. And in the charge flow stock system, only those medications will be charged which are very expensive and it rarely used. So in the non-charge flow stock system, the charges and the cost of the medications will not be that much of high as like even the capsules and the tablets. These are the medications, so the cost will not be that much of high. So in this the charge flow system, the floor stock list will be there, which will be prepared by the nursing station and sent to the pharmacy department, where the duty in charge of the pharmacy department make the drugs available to the nursing stations. And a predetermined list will be sent in the non-charge flow system. Here this list will be prepared by the nursing station based on the selection of the cost of the medications, etc. So based on the selection of the medications, then the quantity or the frequency, so this list will be sent to the nursing station by the pharmacist. Firstly, these nursing stations will send this list to the pharmacy department, and then the duty in charge of the pharmacy department, they will send the this list again to the nursing station along with the medications. So in that envelope method and a basket method is there. Envelope method in charge system and basket method in non-charge system. So basically in envelope system we will be using an envelope through which we will get the medications. In the previous point, I mean in the fourth point, a floor stock list was sent to the pharmacy department through the nursing station. So what they will do, these pharmacy department people, they will keep the medications in the envelope and write the patient's number, name, and ward number on the envelope. So after administration, this envelope will send back to the pharmacy department. Through this envelope, they will enter the data into the registers as well as into the computer system for accounting the charges into the patient's account. So this will be the envelope system or method. Next is in the non-charge system, basket method is there. So in basket method, these nurses, first of all, they will check all the medications present in the rooms and the refrigerator. Then they will prepare a master list, and with the help of a basket, they will send this master list plus requisition form to the pharmacy department. Then these pharmacy department people, they will empty the containers and they will dispense the requested medications to the nursing station through a messenger. So thus the basket method will be like this. We are using basket in that case, where that's where we are using a basket method. And these are the labelings for the charge and the non-charge drug distribution system. So next is the combination of individual prescription order and the complete floor stock. So it is the combination of 1 and 2, and these are very commonly used in hospital nowadays. Means that there will be two options that the patients can take directly from the pharmacy department, or they can get even from the floor stock systems. Means in the medications will be available at the nursing units. So advantages for this is the drug procurement is, it's a one system, so the pharmacy assistant and patient's time will get saved. And medical specialists and the ward units like cardiology, neurology, etc., they will give the first line and the follow-up drugs, which can be dispensed and refilled through a proper selection of the inventory methods. And this combination will lead to patient medication adherence, counseling, and interventions can be reduced. And then the disadvantages is that it needs extra space and cabinets, more space for storage. A special care division will get affected, and the budget requirement will be little much high. Next is unit dose dispensing system. In this unit dose dispensing system, multiples of single dose unit administrations will be prepared and given to a particular patient. So in this system, single unit packages will be there, which will be containing a complete dosage form. It can either be one tablet, one capsule, or 10 ml of oral liquids, or anything. So these single unit packages will be they'll be having a multiple of these single unit packages will be dispensed to the patient for administration. And then the following route, the prescribed time, they will be according to the prescribers only. And the liquids the liquids will be pre-measured, the powders will be accurately weighed and diluted, parental preparations will be suitably diluted. These are the things which are done previously to make a proper single unit packages. So advantages for this is it improves the services round the clock, and all the medications required at the nursing station are prepared by the pharmacy, thus allowing the nursing unit for more time for direct patient care. Then the medication errors can be decreased. Even the duplication of orders and paperwork at the nursing station will be eliminated. Then contamination can be eliminated, and it also eliminates the wastage of drugs and pilferage. Next is disadvantage. So disadvantage is that it require more space, and it require increased number of skilled and lay personnel in the pharmacy department, and the cost of medication will also get increased. Next is the dispensing of drugs to the ambulatory patients. So in this, the ambulatory care or the outpatients are the medical care provided to the on the outpatient basis. Those patients which are able to walk are considered as the ambulatory patients. So in this, the dispensing methods involve various steps. After getting registration, the patients will directed to a particular department where the physician will diagnose the disease and write the prescription, which will be having the name, age, sex, registration number, etc. Then this patient will give the same prescription to the pharmacist. While dispensing, the pharmacist should not make the precautions to eliminate they should take every precaution to eliminate the errors. He should not make any facial expressions. He should not raise any doubts in the minds of the patient. In case of any clarification the pharmacist need about the prescription, he should contact the physician without giving knowledge to the patient. Then he should check ingredients and collect the materials for compounding and dispensing, and they should be correctly compound and they should be correctly compounded, like for pouring and for pouring for liquid, and counting for tablets or capsules. And then these compound prescription they will be filled in a container, and proper labeling should be done, and they should give name, registration number, direction for use on the labeling. And then the pharmacist, he should maintain a register for accounting purpose, and he should give a prescription back to the patient so that he can come for another visit or for revisiting purpose. And those medications which are scheduled under G, H and X, they should be written and dealt with the provision of Drugs and Cosmetic Act, and emergency cases they should be issued medicines immediately. Next is the different types of drug distribution systems in the hospital. It is categorized into three types: controlled ward system, the pharmacy controlled impressed based system, then the pharmacy controlled patient issue system. So first one is the controlled ward system. It is a system where the ward issues a systematic order of medications to the pharmacy. Then these pharmacy department they will issue medications to the ward, and this will be done for a definite period of time, like for 2 or 3 days. Then this in the pharmacy department they will study the order, assemble and send it to the ward. So in this, the pharmacy department is not directly dealing with the original inpatient medication order, and this system is very rarely used. So impress based system, this is the second type of drug distribution system in the hospital and very commonly used. In this, the staff of the pharmacy members they will manage a defined range of drugs or medications in each ward. About 75 to 80% of inpatients distribution of medication to the inpatients is get accounted in through this system. Next is the direct patient issue system. It is of third category. In this system, the medications will be issued directly from the pharmacy to the patient instead of the wards. So it is known as thus it is also known as unit dose system, and in this each dose is directly delivered to the patient directly from the pharmacy department. Next is the charging policy. In this, there should be a uniform schedule for charging of medications. So in that, there are certain policies, a per diem drug charge or all inclusive or no special rate. So in this per day and drug charges will be accounted. So especially first we are studying 250 patient, through which the average daily charges will be calculated. Next, a comparison of actual charge and the projected per diem rate will be calculated for producing a revenue, and thus it gives a quality pharmaceutical service and enables hospital to reduce administrative and accounting cost. Then a part inclusive rate is there. So in this will be charging for medications which are not on the free or supplied list. Then the professional fee concept. So in this, then the professional fee concept, it will meet all the operating expenses including the overhead and compensation, but not the actual cost of the medication or the container. It means that it will include all the indirect charges, indirect cost, but they will not include the direct cost. Indirect cost will be those will be that cost which are accounting for all the other expenses other than the loss and profit. So in this they should not be merged with the markup or the margin, as these terms will imply for the percentage of the wholesale and selling prices. Next is the break even point pricing. So in this system what we are doing, we are not checking whether a profit or loss is there. So in this it will also include the indirect expenses, which can be the expenses of hospital administration, the maintenance, the housekeeping, depreciation of plant, etc. So it includes the other expenses other than the loss and profit, or other than the direct cost, or other than the um, cost of the medications or drugs or containers. So it means that all the medication, all the drug containers, include excluding these things, whatever the expenses we are using, it break even point pricing is all about those expenses, like the hospital administration, maintenance work, housekeeping, etc. So it includes all these things. Next is a cost plus rate system. So in this system we will be checking the profit and loss, you can say. So in the previous two methods we was going for indirect cost. So in this system we will check direct cost. Next is the profit aspect. So in this, profit will be calculated into price by to the patient by following ways. A fixed fee per prescription will be there, then additional predetermined percentage for break-even figure. So with the help of these two methods, they will calculate the profit. Advantages for this is there won't be any loss to the hospital because of the cost of labor of overhead expenses increases from day to day, and even it gets adjusted upwards. And other advantage for this is, in the pre-calculated cost will be there because of the pricing formula, it gets established, and it also eliminates the chance of price fluctuations. And disadvantage for this is it is very rarely used because of the final charges, and there is no relationship between the price of the drug obtained from another hospital or the retail pharmacy. Next is the labeling. Labeling is very important. The concept of pre-packaging is very important for both small as well as for the large hospitals. So in this, improper labeling will lead to insufficient information on the label that will waste the time of the medical and the paramedical staff. So the pattern of the label is as follows: the name of the proprietary or the approved name, then the dosage form, the strength, the batch numbers, expiry date, and the special direction. So mainly in the name should be typed or written in such a manner that it should be legible and prominent. Whereas the dosage form, other than the oral use, whatever the dosage form is administered, it should appear on the label. Then strength, it is also very important, and it should be given in the metric system and whole numbers. Batch number will include the information on the manufacturer's name and address. And expiry date, it will give the information on the limited shelf life of the medication which is placed in that carton or any other thing. Special directions will include the shake the bottle well before use, external for use for external purpose only, not to be chewed, etc. These are the things which are to be mentioned on the label. Next is the dispensing of the controlled drugs. So in this, the opium derivative, the morphine, the pethidine, the barbiturate, the non-barbiturate, these are the medications which will come under the controlled drugs or controlled substances. So to exercise control on the use of these medications, they should be according to the Narcotic and Psychotropic Substances Act, or they should be according to the Drugs and Cosmetic Act. While maintaining these drugs, they should be kept under lock and key. Then a separate register should be there for this issuing and receiving of the medications. Then the medical superintendent, he will be the responsible person for handling of the controlled drugs. After that, after him, the chief pharmacist will be responsible for procuring, for obtaining, and for proper dispensing. So it should be according to the Narcotics and Psychotropic Substances Act. It should include the following details of the patient's full name, address, date, name and strength of the medication, quantity of medication, the signature of the prescriber, dose and route of administration. This was about the general dispensing of the controlled substances or controlled drugs. So if the medication is not present in the hospital, then the doctor, he should take a blank form, and he should write the medication or the prescription in that, and he should sign and send it to the hospital pharmacy. So in this, he have to avoid those PRNs, the short forms, and he should complete the form with the empty containers to the nurses. Inventory sheet should be sent to the pharmacy for dispensing. So these are the things which a medical practitioner should do, and he should also permit the patient to purchase it out from the outside pharmacy. Next, the delivery of narcotic drugs for the pharmacy wards and the nursing station, it should be carried out through a reliable person. So a reliable person is very important for delivery of these medications to the pharmacy as well as to the nursing station. Then these narcotic and the psychotropic substances, they should be charged upon the policy of the hospital. And then the dispensing also should be done according to the rules and regulations. Then the nurses on the duty count, they should physically count the narcotics on each nursing station to check the records. And if the patient refuses or the doctor cancels any medication, these nurses, they should restore the medication into the sink and record refused by doctor or ordered cancelled by the doctor into the records.